Anesthesia for midface augmentation can be performed with an infraorbital nerve block, which is placed through an intraoral approach, which tends to be more comfortable than a direct injection transcutaneously. The landmark for the infraorbital nerve rests in line with the limbus about 1 centimeter below the infraorbital rim. The length of a standard 27 gauge needle places this through this entry port at about the plastic hub at the vermilion border. Additional ports are anesthetized by direct injection of xylocaine for a pinch and pull technique of the lateral cheek. The tissue is grabbed, and in the area of greatest convexity, the introducer needle is inserted, and while still grasping the tissue within the fingers, a cannula is advanced forward with an audible pop as it passes through the capsule of the posterior aspect of the orbicularis oculi. This has gained positive entry into the prezygomatic space. Oftentimes, a granular feeling of the maxillary bone will be present at the tip of the cannula. The cannula can then be angulated downwards towards the zygomatico-maxillary ligaments, and further injection can be performed. If desired, the cannula can be angulated upwards into a hockey stick configuration superlaterally for volume augmentation in that region as well. A technique espoused by Dr. Arthur Swift with a directed injection superior to the zygomatico-facial bundle is carried out with the needle resting on bone at the level of the infralateral orbital rim. Additionally, a sharp needle injection can be carried out at the zygomatico-maxillary ligamentous structures, which creates a rather dramatic lift with a fairly small amount of product injected. Any sharp needle injections done near the inferior orbital rim must be preceded by a reflex maneuver due to the proximity of the zygomatico-facial neurovascular bundle. A cannula can then be inserted through the same lateral insertion point, which is caudal to the orbital malar insertion onto skin, where augmentation can be carried out of the superficial middle fat compartment. By using an anatomic compartment and space approach, it's very easy to replicate symmetry by reproducing the same sequence on the opposite side.